This is COVID-19 with Dr. Richard Brown.
Hello, this is COVID-19 with Dr. Richard Brown. So thanks for joining me today. Summer has come to an end, just about, with the schools starting back up and kids going back. Unfortunately, the number of COVID-19 cases continues to spread out there, so it is not gone. It has reduced over the past couple of years, but it's still out there waiting to infect you. So today I'd like to do a recap of COVID-19 and an update on the fight against this deadly disease. Now, last week we did a town hall meeting at the Fabric Lab here in Omaha, Nebraska. And it is there that we had the public in, and we talked about this update that I'm going to provide to you today, and had question and answer about those things that the public had questions about. So I'm going to start from a basic standpoint, much of which you already know about. You've been living with COVID for the past couple of years here, living with the fact that it's out there and all of the things that people have been saying for and against it. And so you have a basic understanding of what I'm talking about, but I'm going to go to a place where it sort of gives you a brand new zero level or beginning level, just to bring us up to where we are today. So first of all, we know that the coronavirus is an infectious disease caused by an invisible organism that infects the upper respiratory system of the human body, including the lungs. Basic. So we also know that the virus can spread from an infected person through their mouth, through their nose, by way of small liquid particles. When people talk, when they cough, when they sneeze, when they speak, when they sing, when they breathe, any of these avenues may have these small particles that will contain the virus, which is why we talked about keeping away from people a certain distance. So to provide you with just a short history of this pandemic, remember, not too long ago, March 11th, 2020, the World Health Organization declared that the coronavirus infection was indeed a pandemic. It occurred and was found all across the world, the globe. So by December 9th of that same year, the U.S. had its single day of death at 3,000. 3,000 people died on that single day in December 9th, 2020. But by December 14th, we had our first vaccine, which was developed by Pfizer. So that's a short period of time. So between March 2020 and December 14th, we've got our first vaccine. That's a short period of time to develop a vaccine for a disease that we didn't know a lot about at first. So then the first shots came available and went to the hospitals, went to the frontline healthcare workers, and also to long-term care facilities, because we knew those were the most vulnerable populations and they were on the front line. So hope was born during that time. I mean, this worldwide nightmare we thought was over or about to be over, because now we've got a vaccine. But in April 19th of this year, 2022, CDC lifted the mask mandate for the airlines and for the travel. And this took place because a 34-year-old Trump-appointed judge said that it needed to be done. It was based upon a legal opinion, not a public health or scientific opinion. So, as we speak, as we spoke last week, which is around August 23rd, the total cases worldwide were 601,254,050. These are the number of cases worldwide. The number of deaths worldwide was 6,472,851. Now, the total cases in the U.S. was 95,345,858. The deaths in the U.S. as of last week was 1,065,569. That's a lot of people that have died from this virus. So it is serious, no matter how you look at it. This is a serious disease and should be recognized and understood and adjusted to. The total number of cases in Nebraska, where we live, as of last week was 529,769. The total deaths was 4,445 in the state of Nebraska. Now in Douglas County, where we're located, Omaha, the total cases were 166,312. The total deaths in Douglas County was at 1,161. Those that were hospitalized as of last week was 143. So we've learned a lot about this disease, but there's still some myths out there. Some of them have been dispelled. Some of them are still floating around. But I wanted to go through the myths just to bring you up to date as to where we are now. So one of the first myths I want to bring attention to was that the vaccine themselves cause COVID-19. Well, that's not true. However, 36% of the unvaccinated adults believe this, and 41% of unvaccinated Blacks believe this, but it's just not true. Second myth, that the vaccines cause infertility, which means it decreases and actually destroys your ability to have a child if you are a female or a male. So 29% of the unvaccinated adults believed this myth. 31% of Republicans believed it, and 34% of the Republicans also say that the vaccine contained fetal cells, but this is all not true, just not true. The next myth was that the vaccine changes your DNA and that you should not get vaccinated if you have had COVID already. So it does not change your DNA. If you've had COVID, you should get vaccinated anyway because you can become reinfected. So just because you've had COVID does not mean that you can't be reinfected. I mean, think about the flu. Every year, the flu comes and kills about 60,000 people in this country. But we develop a new flu vaccine every year, and you should get your vaccination every year because the virus keeps mutating. And so it is not true that once you get COVID, you don't have to worry about it. Another myth is that the unvaccinated, especially among the Latino population, they think it costs them some money, that it's going to cost some money that they do not have, and that if they're undocumented, that they may be deported. Well, this is all not true as well. It doesn't cost anything to become vaccinated. Every citizen, every non-citizen, every human being can be vaccinated in the United States at no cost. So let me continue with a few more myths. So some believe that you can't trust COVID-19 vaccine because they were rushed. They developed the vaccine too fast. And so I want to say that there was new technology used along with an enormous amount of money that was injected into the system, both to the scientists and manufacturers, that made it happen so fast. So between March of 2020 and December of 2020, the vaccine developed because millions and millions of dollars were put into the system to develop this vaccine. Also, is that this is not the first coronavirus that we have. Remember, it's COVID-19. So we've had COVID 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 18. So scientists know about it and have studied this. And so it was not rushed that fast. It was rushed to develop a virus against COVID-19, but the processes that go into developing vaccine have been around for years and years, and specifically as it relates to COVID. Another myth is that the vaccines are not safe. The vaccines are safe. As a result of people getting vaccinated, thousands and thousands of people have not died, thousands have not become ill, and thousands have not become hospitalized because the vaccines do work. Think about it again. Our children have been vaccinated against various diseases for the past, 50, 80 years or more. You couldn't even get in school unless your kid had certain vaccinations. And so vaccinations work, they're real, they save lives. And so it's a myth that it does not. And then there was the vaccine that they said causes microchips. This is truly not true. This is a myth. Now, there are some microchips that you can place into the human body. We know that scientists can do that. You've seen it in the sci-fi movies, and it could actually happen. But this vaccine does not have any microchips, and it is not placed into the human body. It consists of a vaccine made up of an mRNA process, and it's made up of lipids and a pH stabilizer. So it's not even using live viruses. It's not using live COVID-19 virus. It is a different type of a vaccine that's developed without that. So it's not true that it contains microchips. Another myth is that the vaccine will alter my DNA. Well, I mentioned that already. There's no scientific proof and evidence that that happens. And then finally, it says that I already had COVID, so I won't benefit from a vaccine. As I mentioned already, that's not true. Health experts report that it is appropriate to get the vaccine because we do not yet know how long natural immunity will last for this vaccine. We understand now that it lasts about 6 to 9 months, okay? Which means that every 6 to 9 months, for what we know now, is the time frame by which the vaccine wanes or wears off, and you may need to get a new shot. Okay, a couple of more myths. So the survival rate is so high that I don't need the vaccine, meaning that, people get it and then they don't die, they get sick a little bit, but then they come back, and so we don't need to get it. Well, it is true that most people will recover. But as I said already, 6.5 million people worldwide have died because of COVID-19. The diseases can cause long-term effects such that damage the lungs, the heart, and the brain. The vaccine protects people all around you as well. Another myth is that once vaccinated, I won't have to wear a mask or exercise social distancing. Not true. Even though you're fully protected, perhaps by having, your shot and your booster, full protection doesn't take place until about 3 weeks after you get your second shot of Pfizer or Moderna. And it is not clear that the vaccine protects against people who have asymptomatic infections. This means that people may have the virus, but they have no signs, no visible signs that they're infected. They don't have a headache. They don't have achy muscles. They don't cough. They don't have the other symptoms. And so we don't really know how long the vaccine protects those individuals. And so another myth is that now that we have vaccines, the pandemic will be over soon. Absolutely not true. It has been now going on 2 years, almost 3 years now, that we've had the vaccine. Many people have been vaccinated, but there's still variants taking place. And so it's not going to be over soon, not until we achieve something called herd immunity. And herd immunity takes place when the entire population of about 90% have been vaccinated. That's herd immunity. Until that takes place, the virus will continue to mutate. Right now, I think the country is only at about 72% vaccinated. So the virus has places to jump to. It's always looking for new places to jump to do what it does, which is to stay alive and to duplicate and then eventually kill its host. And so finally, the Tuskegee Tuskegee Experiment. Well, yes, the Tuskegee Experiment did take place. It did happen. But there's been lots and lots of fail safes put in place at this point that I don't think that'll happen again. I've been to Tuskegee. I've met some of the syphilis experiment persons involved, and lots of elected officials and government officials, and I worked in government for a while. So I feel pretty confident that the Tuskegee Experiment type situation will not take place again. So now I want to talk about a few facts. We got the myths out of the way. Let's talk about some facts. Now, the facts are that the top sources of information on vaccine for unvaccinated adults are cable TV, network, local TV news, friends, and family. But their misconceptions could still mostly be coming from social media. Social media produces a lot of stuff. Matter of fact, people from 18 to 29-year-olds get most of their information from social media. That's according to Kaiser Permanente. Fact: doctors, nurses, community health workers, and pharmacists are both important sources of information for unvaccinated Americans and trusted managers. They have a special role to play in their communities, clearing up the myths about vaccines that remain among the most hesitant groups. Now, I mentioned something about variants. In the beginning, we had COVID-19, March 20th, right? So by 2021, a variant appeared among the virus called the Delta virus. By 2021, later part of the year, the Omicron variant, which is a subset of the Delta, appeared. And in 2022, scientists have now discovered an additional variant, BA.5, which is more deadly than the Omicron and the Delta before. It gets you sicker, but it doesn't have some of the effects such that because we have the vaccination and because we know more about how treating it, it's less dangerous from the standpoint of those ultimate disasters such as death, but it is more infectious. So prolonged vaccine inequity and the desire to move on beyond COVID-19 will lead to more and more new unpredictable variants. That's according to the World Health Organization. So what that means is that the more we continue to not wear our masks, the more we can go out and participate in activities that involve large crowds, thinking that we don't have to wear a mask because the disease has gone away. It's just not true, because it is looking to establish new variants. And as long as we continue to be unvaccinated, or we exchange these small liquid particles between each other, we can possibly continue to infect each other. And then there's something called long COVID. I didn't talk about this last week, but I'm going to talk about it today. Long COVID has been discovered. Again, this virus is something that we learned about in 2020. Now we're in 2022, and we're still learning things about it. So things have been showing up among humans. Populations have begun to develop some aches and pains and symptoms that didn't exist before COVID was around, and didn't exist before these people were infected. So definition: long COVID is a range of symptoms that can last weeks and months after first being infected with the virus that causes COVID-19, or can appear weeks after the infection. Okay. So weeks after the infection, even though you may have gotten vaccinated, you may get what's called long COVID. Weeks can go by and long COVID will show up, perhaps. Now, here are the symptoms, which is a lot of them, and they are similar to other things that you may feel and that have felt with the flu and some other viruses or infections. But these are specific to long COVID. Tiredness or fatigue. I mean, some people feel that every day, no matter what. Difficulty thinking. Some call it brain fog. Headaches. Some people have them too. Loss of smell or taste. Now, that's specific to COVID-19 and long COVID symptoms. Dizziness on standing. Pounding heart rate or heart palpitations. You may get some chest pain. Shortness of breath and cough. Joint muscle and pain and fever are also long COVID symptoms. You might even experience some depression and anxiety. And then symptoms that get worse after physical or mental activities are considered to be COVID, long COVID. So let's talk about the risk of COVID-19 outcomes. The higher risk for severe COVID-19 outcomes. If you fall into these categories or anything of these fit you, then your risk of having a more severe outcome is greater. So if you have cancer, cerebral vascular disease, chronic kidney disease, chronic lung disease limited to interstitial lung disease, pulmonary embolism, pulmonary hypertension, bronchitis, COPD, if you have any of these and you get COVID, your outcome could be more severe. Chronic liver disease is limited to increased risk of COVID outcomes. Cirrhosis, non-alcoholic fatty liver disease. My daughter had that several years ago before COVID, and she almost died, and we couldn't figure out what was going on, but other than she had non-alcoholic fatty liver disease. She's healthy now. Matter of fact, she's gained a little more weight than she should, because she was down to about 90 pounds now. Oh, okay, I'm telling too much. Alcoholic liver disease, or if you have autoimmune hepatitis, these areas are make you more vulnerable. Cystic fibrosis, diabetes, mellitus, type 1 and type 2. Type 1 and type 2. Many people in the Black community are subject to and victims of diabetes type 2. And I say victims, although they don't have to be victims, because type 2 diabetes can be curable among certain people. And that's a whole nother segment, but it has to do with your lifestyle in terms of what you eat and the exercise that you do and how you conduct yourselves to be rid of type 2 diabetes. But disabilities, any of these disabilities that you have, make your risk for COVID-19 to be more severe. And that's cerebral palsy, limitations with self-care or activities of daily living, learning disabilities, spinal cord injuries. If you have a heart condition such as heart failure, if you've got HIV or any mental health disorders, then you're at risk. Neurologic conditions limited to dementia, you're at greater risk. Pregnancy and recent pregnancy causes you to be more at risk if you catch COVID-19. Smoking, current or former smokers, if you fall into that category and you get COVID-19, your severity is greater. And with the remaining time I have, I just want to go through the booster. And this is going to be around for a while. So just want to make sure we understand what's going on with it. So who should get a booster? And a booster, of course, is the shot that you get after you get your first COVID shot. Anyone 12 years and under can get a booster. Who could get a second booster? Anybody that's 50 years and older should have a second booster. And when should you get your booster? At least 5 months after completing your primary COVID-19 vaccine series. And so the series may be 1 shot with Moderna, maybe 2 shots with Pfizer. And as they have developed additional series, it may change a bit again, because we're still learning and things are changing. Although people try and say, oh, they didn't tell the truth. CDC didn't do this, and Dr. Fauci did. Well, they were learning as the disease progressed. And believe me, they were learning much more than those of us out here were learning. And so we ought to respect those high-powered, highly educated scientists who have dedicated their lives to keeping us healthy when they speak to us. So if eligible for a second booster, at least 4 months after your first booster, you should take it. So when you get the booster, see which boosters can you get? Again, the Moderna or the Pfizer. Second booster must be an mRNA COVID-19 vaccine. And see, the teens that talk about 12 to 17 years old can only get the Pfizer COVID-19 booster. And primary series COVID-19 Moderna is one that's listed too. So in general, get your shot, get your boosters, talk with your primary physician to see when the booster should be taken, and live with the fact that this disease is going to be with us. It is continuing to every day fight to make sure that it survives. And so we as human beings, we must fight to make sure that we stay alive. Now, we've lost 6.5 million, and between 300 and 1,000 are still dying today. And so the fight is on, and we should continue to fight, okay? And with that, we want to go through and make sure that we continue to do the sanitation things that we've done. There's lots of slogans that we've developed over the past couple of years about this COVID-19. Under sanitation, we said that the coronavirus is real. Its only mission is to kill. You should wash your hands and sanitize as often as you can. Avoid large crowds and wear a mask. Protect your fellow woman and man. Testing, whether north, south, east, or west, you must test and test and test. Physical distancing. Practice physical distancing. Follow science and public health reps. Stop this corona from spreading. Just follow the safety steps. Other slogans are this: the virus has taught us that we're all in the same boat. The mask is a friendly flag of love and future hope. Hospitals are getting full. Don't be a fool. Save yourself and your family. Wearing a mask is cool. So there's lots of testing sites, especially here in the Omaha area. Charles Health Center, One World Community Health Center, Walgreens, CVS, Kohl's, pharmacy. So, bottom line on all of this, bottom line, is that you must begin to think seriously about this one body that you have to live inside, for one life that you had to live, and make sure you treat it with the utmost respect, and make sure that you put things into it that are healthy, that you live a healthy lifestyle, that you do all the things to make sure that you're going to live as long as you can. There's children born now, today, that will live to be 120, 150 years old because of all the modern technology and scientists that have perfected the existence of mankind. And so we got a long ways to go. We can be here a long time if we do all the right things to make sure that we fight this virus, and it is in our hands. So once again, this is Dr. Richard Brown and COVID-19. And Dr. Brown, we'll see you around.
This has been COVID-19 with Dr. Richard Brown. If you'd like to leave suggestions, email us at ewcfacts@gmail.com. That's ewcfacts@gmail.com. This has been an EWC Communication production.